Welcome to week 2 of Nursing 301. I'm going to try to record this chapter one more time. Did it yesterday and I hit the wrong button and lost everything I recorded. So second time should be the charm, right? Hopefully I don't have to do it for the third time. But here we go. Chapter 91 covers female reproductive disorders. Gynecology, of course, focuses on the female reproductive system, and the physicians involved are a gynecologist or obstetrician, gynecologist, or OB/GYN. So we're going to start with diagnostic test. First one is the pelvic examination, which pelvic exams examine structures visually, and they're able to palpate internal structures. To visualize this, it's used to visualize the cervix, the vagina, and the perineum. Preparing for the exam, you want your client to empty their bladder and encourage them to deep breathe because it relaxes the muscles. So remember, for preparing for the exam, you want them to empty their bladder and encourage deep breathing as it relaxes the muscles. They also use a pelvic exam to do a cervical biopsy, and for cauterization, removal, or coagulation of a portion of the cervix, use an electricity or laser. So the nurse assists the healthcare provider with any of the supplies that are needed, such as KY jelly, speculum, gloves, and supplies needed for a pap smear. I don't know what's going here. I keep hitting the wrong buttons. Neoplasms, there we go. This is the screen I want. Tumors of the ovary, benign ovarian tumors, or malignant ovarian tumors. Benign ovarian tumors, cysts, they can cause pain if they rupture or twist. Malignant ovarian tumors often displays no early signs. It's usually detected after metastasis has occurred. It is a frequent cause of death in young women. They treat with a total abdominal hysterectomy and the removal of both tubes and ovaries, as well as radiation and chemo. Tumors of the uterus. We have benign uterine tumors. Most common is your fibroid tumors. They usually grow slowly and arise from muscle cells. It's related to hormonal influences. Symptoms are abnormal bleeding, heaviness in the pelvic region. Cancer of the uterus, cancer of the fundus, which is the body of the uterus, or endometrium. It's most likely to occur in postmenopausal women. The first sign of uterine cancer is vaginal bleeding. They're at an increased risk if they have received estrogen replacement, and they treat it with a hysterectomy followed by radium implantation and chemo. Cancer of the cervix. It is almost 100% curable if it's discovered early and treated before it spreads. Signs and symptoms. The first sign is bleeding, but it does not occur in the early stages when a positive pap test would indicate the presence of cancer cells. It can also occur after menopause. Staging of cervical cancer. That is located in your book. On page 1677, you can read through the different stages. I promise there is no question regarding staging of cervical cancer on any of the quizzes or midterm or final. Treatment, early stages, they do radiation, conization, or laser surgery. Early and middle stages, they may do a hysterectomy, radiation, and chemo. So cervical cancer in the pregnant woman. If in situ, treatment is delayed until after delivery. If it's invasive and discovered early in pregnancy, pregnancy is terminated and cancer is treated. If it's discovered late in the pregnancy, like the 3rd trimester, treatment is delayed until the fetus is viable and a cesarean delivery is done. Caring for a woman undergoing a hysterectomy. So remember, a hysterectomy is removal of portions or all of the female reproductive system. So pre and post-op, we want to make sure when we care for a woman undergoing a hysterectomy, we want to answer all their questions fully. We want to include their spouse, significant other. We want to talk to them about Foley catheters, that they may have a Foley catheter inserted. Talk about wearing TED hose. If they've had a vaginal hysterectomy, provide them with sitz baths. We talked about that earlier. If they have a vaginal hysterectomy, offer them sitz baths. You want to make sure they have TED hose, and you also want to check the amount, color, and odor of drainage, and make sure you document that information. Risk factors for developing cervical cancer is infection with the HPV, sexual activity at a young age, frequent sexual activity, or multiple sex partners, presence of genital warts or herpes virus type 2, maternal history of cancer, especially cervical cancer, and maternal use of DES during pregnancy with this daughter. Breast neoplasms. Most breast lesions are benign. They tend to be round or oval with smooth borders. Malignant lesions are more likely to be irregularly shaped and hard. Malignant lesions are more likely to be irregularly shaped and hard. Often show secondary signs such as enlarged lymph nodes in the axillary areas. Chronic cystic mastitis is the most common breast disorder between the ages of 30 and 50. It's related to hormonal imbalance and activities of the ovaries. Caffeine can also aggravate cyst formation. So remember, benign, malignant lesions of the breast are most likely to be irregularly shaped and hard, and caffeine can aggravate cyst formation. Breast cancer forms in the cells of the breast tissue. It usually becomes more evident as cancer advances. Prompt action may mean the difference between life and death. They may have nipple discharge, a history of pain or tingling without a palpable mass, breast enlargement or thickening or nipple retraction, redness with swelling and heat, or puckering in any area of the breast. Diagnostic test for breast cancer is a CBE, a mammogram, a breast ultrasound, a breast biopsy. Remember, the breast biopsy is the only diagnostic test. And treatment depends upon the stage. They may do a lumpectomy, a total mastectomy, chemo, radiation, hormonal therapy. So, treatment depends upon the stage. They can do reconstructive surgeries. There are 2 types. There's implants or skin, muscle, and fat move from another part of the body to the breast area and shape it to form a realistic looking breast. It can be done at the time of surgery or delayed to a later time. And then they also have prosthetics, which is prosthesis, which is an artificial breast form that is inserted in a bra. Risk factors for breast cancer: menarche prior to age 12, late menopause, long or irregular menstrual cycles, or women older than 40. I think that age group may be changing some because I know a lot of individuals in their 30s that have breast cancer. Family history of breast cancer, fibrocystic breast disease, cancer of the other breast, endometrial or ovarian cancer, radiation exposure, or previous breast surgery or estrogen replacement therapy for longer than 8 years. Women who have never had a baby, had their first baby after age 30, have not breastfed, or are on antihypertensive therapy. They also, if they've had a diet high in fat, obesity, alcohol, or tobacco use. These are all risk factors for breast cancer. So pre-op and post-op. Following, if a client, they learn that they have breast cancer, it begins as soon as the woman learns a breast biopsy or surgery is needed. Patient education. Patient education is essential, especially if they have to have surgery. You want to talk about post-op exercises, drain placements. If they're having a biopsy, you want to talk to them about what is the procedure for a biopsy. When will results be received? What are the next steps? And post-op, it's routine post-op care. Excuse me. You want to encourage the post-op exercises, elevate their arm to minimize the development of edema. You want to monitor those drains and note the amount of drainage and the character of it. So make sure you document that and provide emotional support because they're likely to experience grief. So you want to provide that emotional support, provide that patient education, and make sure you document patient education. So I have just a few questions here for you before we end this. So following a laparoscopy, a client may feel severe pain under the clavicle. It is true. It's called, they may call it shoulder strap pain, but this type of referred pain may be a result from either gas instilled during the procedure, which is temporarily trapped under the diaphragm, or from blood accumulating under the diaphragm. But it can be felt as a pain under the clavicle. Women who have had a hysterectomy and who still have a cervix are not at risk for cervical cancer and do not need to have a Pap test. That is false. All women with a cervix are at risk for cervical cancer, even women who have had a hysterectomy but who still have a cervix are at risk for cervical cancer and need to have Pap test. Another question, if a pregnant woman contracts trichomoniasis, treatment is postponed until after she has delivered her baby. That is false. If a pregnant woman contracts trichomoniasis, treatment is necessary, although it can be postponed until the second or third trimester because of the unknown effects of the drug on the developing fetus. Untreated trichomoniasis can lead to a fragile cervix that will be unable to maintain pregnancy or withstand delivery. And last but not least, last question. A nurse should encourage female clients to get a regular mammogram as well as conduct breast self-examinations. That is true because according to research, some breast cancers may exist for as long as 6 years before they are detected by palpation. So that is the end of chapter 91 for week 2. If you have any questions, you can contact me via email at bolson.e bolson@iot.edu. And remember, Olson is spelt with an O. Have a great week.